my name is Denise Brentgard, and I'm the General Manager of the Novo Nordisk Hemophilia Foundation, one of the sponsors of the meeting today, the East African Blood Disorders Leadership Forum that's taking place here in Nairobi. For me, my key takeaway of the meeting is that we need to definitely get to the next level. A lot has happened, a lot of progress, fantastic progress across the 4 countries that are represented here: Kenya, Tanzania, Uganda, and Rwanda. And now we need to look into what we need in order to get to the next level. What is that next level? It's apart from the service delivery, the health workforce, the patient communities that have been established and that also strengthened. It is the health financing, the government collaboration, the government commitment to blood disorders. So this meaning bleeding disorders and sickle cell disease. So I look forward to working with all the different partners here in Kenya and across the East African region to make that happen.
My name is Professor Karanja Njoroge. I'm the chair of Kenya Hemophilia Association here in Kenya. We've been at it for the last 10 years, trying to help people living with the bleeding disorder called hemophilia. And we've worked very closely with Sickle Cell Association of Kenya. And one of the few things that we have learned over these years is that we stand to do better when we work together to improve on our advocacy to government, to hospitals, to communities, to encourage people to disclose their conditions of young boys living with hemophilia who go unnoticed, particularly in our communities. When a child starts bleeding, maybe they are cut and they don't stop bleeding, or they start having knees swollen because of internal bleeding, and the community then says wamerogwa, oh hawa jamaa wana shida. It is a terrible thing because we have a solution for their problem, and we need you to go out there and bring them to fruition. We have opened many clinics throughout Kenya, from the coast to Garissa to Kisii to Western Province. We need people to bring out anyone, any young man who you know bleeds without ceasing, or it takes too long to get to stop bleeding when they cut themselves. So that is my message, and I think this weekend or these 2 days have been spent very well, because we are also learning from our brothers in Uganda, in Rwanda, in Zambia, on what they do. We have been working very closely with Tanzania, but I think it's now time we looked at this condition across the East African nations and see whether we can even have collaborative support systems that can enrich and bring out all those people who are living with these conditions.
My name is Rachel Olwanda. I'm a member of the Sickle Cell Federation of Kenya. In the Blood Disorders Forum, my take home, the essence of synergy amongst multiple stakeholders. If we play together, then we maximize on the resources and integrate services that are available, and that helps with the health outcomes.
My name is Dr. Sam Bunya. I'm an advocacy relations consultant working with various organizations such as AMPAT, Indiana Hemophilia and Thrombosis Center, Innovative Hematology, and also my consultancy, Dr. Mbunya Health and Leadership. So the take home for this Blood Disorders Forum, ideally we've gotten to see that there is strong partnerships and alliances. We are seeing the leadership of the 3 or 4 or 5 countries coming together, and to have that dialogue is very key and crucial to understand the challenges that we're facing as a blood disorder community. And also at the same time, the government support that we've gotten, and we have also seen other countries such as Zambia who have been part of this forum and have also shared the experiences. So it means that this Blood Disorders Forum will give us an opportunity to even expand to other countries, especially in the South, and also reach out to the other countries in East Africa, such as South Sudan, Ethiopia, Somalia, and of course Burundi as well.
My name is Selina Olwando Bueno. I'm a caregiver to a young warrior living with sickle cell anemia, and also I'm an advocate for sickle cell disease, and I am an advocate within the Children's Sickle Cell Foundation. I'm also a member of the Sickle Cell Federation of Kenya, and our work is to ensure that people living with sickle cell get quality of life and dignity in care. So the Blood Disorders Conference is a good opportunity to also express some of those needs that we have, and especially in the community. Certain policies need to be put in place to protect people living with sickle cell, and these policies are things that we need to advocate for in forums like these ones. This is where we meet each and every person, we discuss our frustrations, we talk also about our successes. But most importantly, I'd like to note that the Kenyan government has made better strides in management of sickle cell disease compared to some 5 years ago. Today, the conversation is all about sickle cell. How do we care for them? How do we give dignity back? As caregivers, there are quite a number of frustrations caregivers face, starting from rejection from family members, and also to efforts to lengths where they even are denied opportunities in their workplaces because they cannot be able to afford to spend time to go to work as prescribed.
And also the inclusion, let's not forget, of people living with blood disorders who have also been part of this meeting. The take home, of course, for me is that we are continuing to engage with various stakeholders and partners to be able to work together and harmonize the goals and objectives and initiatives of each individual country, especially to ensure that there is access to diagnostic tools and also access to medicines. Those two areas are very crucial so that we can ensure that the blood disorder community are thriving, and also looking at initiating other opportunities such as revolving funds services, such as ensuring that we have a sustainable approach to keep these equipments functional, and also looking at access to the medicines, as I've mentioned.
My name is Grusha Amunga. I represent King Olboho Foundation, an organization representing patients living with sickle cell disease. It was formed in honor of my brother Griffins, who died a warrior of the sickle cell disease. And one of the key takeaways home from this forum, it is the learnings from Tanzania and how they are from Tanzania and how they are running their sickle cell disease advocacy and awareness and care for the patients, including the newborn screening, the way they have appointed a focal person for them to advocate for them in the governments and all that. I think that's such a great learning that Kenyans, sickle cell patients, we need to come together, find people who are going to represent us in the parliamentarians, look for people who are going to speak for us and support our visions and support for the need for us to have a great care when it comes to the sickle cell disease.
My name is Isaac Okelo, and I'm a sickle cell champion from Uganda and Raising Hope International Friends. Today I'm actually participating in the East Africa Blood Disorder Leadership Forum, and my take from this is that it is exciting that all different stakeholders are talking about how to move, decisions and involve, stakeholders, legislators in pushing for action to formulate policies around blood disorders.
Sharon Awor Odhiambo from Kenya, a sickle cell warrior. My takeout from this event is that it's very important to collaborate, to enable us make efforts towards blood disorders in our community. And I wish to say that whatever we've discussed in this event should not just remain within these walls, but let us take it upon ourselves to take actions and to ensure that everything is done and accomplished as said today.
My name is Chilufya Pikiti from Zambia. I am a caregiver with 2 boys with sickle cell and also a founding member of the Zambian Childhood Cancer Foundation and the Hemophilia Foundation of Zambia. We work with both children with sickle cell and hemophilia, and I'm proud and happy to be here, and happy also proud to see what I've seen, because I think it's a journey that started a few years ago. And again, on the initiation of this journey, I was here of creating a East African Leadership Forum, and we've seen a lot that our friends in East Africa have made a lot of progress with the joint projects and also pushing the agenda on the sickle cell and the hemophilia side. And furthermore, we've seen, I think, leaders also coming from all the different countries that are involved, and there is that level of unity. That's the issue that we should all be pushing in Africa, in all the countries that are affected. We are all affected. It has been a learning curve to learn and see how our friends are pushing, and also we had to share also our experiences, because we are also not just sitting, we are pushing a lot and doing a lot also for children with and adults with sickle cell and hemophilia.
My recommendation to such challenges and problems is that we first need to look at these people from the level in which, how do they get diagnosed, who diagnoses them, who cares for them, both from the household and also from the hospitals. Are they well equipped to manage a child with such challenges? And as they grow up, they should also be armed with important tools for their care. And this is where we empower people living with sickle cell, give them opportunities, even despite having challenges in being able to achieve certain things at some point. We need to also respect people living with sickle cell anemia. Respect is one of the things that has always been commanded, because we find that the children and their caregivers are addressed in ways which dignity is not sustained, or even privacy. Telling a mother that your child will die when they are 10, when they are 4, when they are 5 is not a fair thing to tell anybody. Lack of respect, lack of knowledge, lack of awareness leads to such careless utterances. Awareness is one of those things that we have no excuse for. Everybody must speak about sickle cell, and the government must heavily contribute towards awareness. It is only information that makes a nation stronger. The other thing is that for people who are going to schools, have we equipped our school system to be able to accept them, care for them, and allow them the chance to learn? Workplace is hostile because it's all about competition and not empathy. We should also look at giving these people an opportunity to compete in these spaces, but being given certain leniencies to be able to strive. And finally, what is our country and what is the region of East Africa doing about any legislation? Do we have, or are we looking at coming up with a Sickle Cell Act? It's over time, it's about time. Today, the disability have a bill and they are protected. Somebody living with sickle cell may stand next to you and you'll not see that disability, but this person needs much more. So anybody with blood disorders already has one disability. Their blood is not able to serve them like any other person. And therefore, one of the things we want as the people who have blood disorders to have an act of parliament that can influence the East African governments, so that there's a bill that comes up, a bill that will be able to protect people living with sickle cell, give them opportunities, and also care for their caregivers, so that their caregivers can also be given equal opportunity to care for these children. And to close, I want you to imagine a situation where a family has 2 or 3 people living with sickle cell disease. What is their priority? Is their priority food, or is their priority going to hospital? Think about it.